Colon cancer, traditionally viewed as a disease of the elderly, has been silently creeping into the lives of younger adults. This shift demands a reevaluation of how we perceive, diagnose, and treat this serious health condition. Recent reports indicate a concerning rise in cases among adults in their 20s and 30s. This emerging trend impacts real lives, families, and communities. The increase in incidence rates among young adults suggests that colon cancer is no longer a disease that can be deferred to later in life for consideration. Understanding and addressing this rise is crucial for medical communities and public health officials alike. The symptoms of colon cancer in young adults can often be ambiguous and easily misinterpreted, leading to delayed diagnoses and treatments. Consequently, there is a pressing need to delve deeper into the causative factors behind this trend and to strategize effective prevention and early detection measures. In the following sections, we will explore the recent statistics, risk factors, symptoms, and preventive strategies concerning colon cancer in young adults. The recent upsurge in colon cancer cases among young adults is both startling and disconcerting. According to a study, there has been a 2% annual increase in colon cancer cases in individuals under 50 since the early 1990s. This increase contrasts sharply with the rates in older adults, which have generally been declining due to better screening practices and awareness. The implications of such statistics are profound, as they suggest that young adults are now facing risks that were once considered unlikely at their age. The reasons behind this rise are multifaceted, involving genetic, lifestyle, and environmental factors. Addressing this issue effectively entails equipping healthcare providers with the necessary tools and knowledge to recognize and react to this trend. It also involves educating the public, particularly young adults, about the importance of being attentive to the changes in their bodies and seeking medical advice promptly. Identifying and understanding the risk factors associated with early-onset colon cancer is fundamental to combating this disease. Lifestyle factors such as diet, physical inactivity, obesity, and smoking have been closely linked to colon cancer. Diets high in red and processed meats and low in fiber, fruits, and vegetables are particularly detrimental. These dietary habits, prevalent among many young adults, contribute significantly to the risk of developing colon cancer. In addition to lifestyle choices, genetic predispositions play a crucial role. Approximately 5 to 10% of colon cancer cases are believed to be primarily due to inherited genetic mutations. Families with a history of colon cancer or related syndromes are at a higher risk, and thus genetic counseling and early screening could be life-saving for individuals in these families. Environmental factors, including exposure to certain chemicals and pollutants, can also contribute to the incidence of colon cancer. Therefore, a multifaceted approach that includes lifestyle modifications, genetic screening, and environmental awareness is essential for addressing the rising incidence of colon cancer in young adults. Recognizing the symptoms of colon cancer can be challenging, especially in young adults, as these signs often mimic those of less severe illnesses. Common symptoms include changes in bowel habits, such as diarrhea or constipation, that persist for several weeks, blood in the stool, and abdominal discomfort or bloating that does not go away. Unexplained weight loss and fatigue are also critical indicators that should not be overlooked. The subtlety and commonality of these symptoms often lead to misdiagnosis or dismissal, both by patients and healthcare providers. This is particularly true when symptoms are intermittent or mild, leading individuals to postpone seeking medical advice. Educating both the public and healthcare professionals about these symptoms and taking them seriously in young adults can lead to earlier diagnosis and significantly better outcomes. Encouraging open conversations about gastrointestinal health can lead to greater awareness and timely medical consultations. Diagnosing colon cancer in young adults presents unique challenges. The prevailing perception that colon cancer is primarily a disease of older age often leads to initial misdiagnoses or significant delays in considering colon cancer as a potential diagnosis. Common symptoms like abdominal pain and changes in bowel habits are frequently attributed to less severe conditions like irritable bowel syndrome, particularly in younger patients. This diagnostic oversight can be partly attributed to a lack of awareness and the hesitancy of young adults to undergo invasive tests like colonoscopies. In light of these challenges, there is a critical need to refine diagnostic protocols and guidelines to better accommodate the age shift in colon cancer incidence. Leveraging technology and telemedicine could play a pivotal role in overcoming these challenges. Lifestyle choices are profoundly impactful in the context of colon cancer. Diets rich in processed foods and low in fiber are prevalent among younger demographics and have been directly linked to increased cancer risk. Regular consumption of fast food, sugary beverages, and high-fat foods contributes to obesity, another significant risk factor for colon cancer. Physical inactivity is another lifestyle aspect that has detrimental effects on colon health. Sedentary behavior, prevalent in modern work and leisure activities, promotes conditions like obesity and metabolic syndrome, which are known to increase cancer risk. Encouraging regular physical activity, therefore, not only helps in maintaining a healthy weight, but also reduces the risk of developing colon cancer. Promoting a holistic approach to health, emphasizing balanced diets, regular exercise, and the avoidance of tobacco and excessive alcohol, could significantly reduce the incidence of colon cancer in young adults. Genetic factors play a significant role in the risk of developing colon cancer, particularly when it occurs at a young age. Individuals with a family history of colon cancer or hereditary cancer syndromes like Lynch syndrome are at a heightened risk. These conditions can significantly lower the age at which cancer develops, making early screening and surveillance crucial. Understanding one's family health history and discussing this information with a healthcare provider can lead to tailored screening strategies that begin earlier and occur more frequently. Genetic testing is also a valuable tool for those at high risk, providing essential insights into personal health risks and guiding preventive measures. This proactive approach can lead to earlier detection, where treatment is typically more effective and less invasive. Awareness and education are pivotal in addressing the rise of colon cancer among young adults. Misconceptions about the age at which colon cancer can occur often lead to complacency both in potential patients and healthcare providers. By dismantling these misconceptions through targeted awareness campaigns, we can shift the narrative and encourage earlier, proactive health screenings. Educational initiatives should focus on the importance of recognizing early symptoms and understanding the risk factors associated with colon cancer. Social media, as a ubiquitous communication tool among young adults, offers a powerful platform for disseminating this vital information. Engaging campaigns that resonate with the lifestyle and communication styles of younger demographics can significantly increase their reach and impact. These collaborations can play a crucial role in changing public perceptions and behaviors regarding colon cancer in young adults. Preventive measures against colon cancer are crucial, especially considering the modifiable nature of many risk factors. Dietary changes play a fundamental role. Increasing the intake of fiber-rich foods like fruits, vegetables, and whole grains while reducing red and processed meats can significantly decrease risk. Regular physical activity is another effective preventive measure. Engaging in moderate to vigorous exercise for at least 150 minutes per week has been shown to significantly reduce the risk of developing colon cancer. This activity helps in maintaining a healthy weight, improving gut motility, and enhancing the immune system, all of which are important for cancer prevention. In addition, minimizing alcohol consumption and quitting smoking are essential steps. Both alcohol and tobacco are known carcinogens that contribute to an array of cancers, including colon cancer. Public health initiatives that support smoking cessation and moderate alcohol use are vital in this context. Early detection and screening are arguably the most powerful tools in the fight against colon cancer. Regular screening not only helps in detecting cancer at an early stage when it is most treatable, but can also prevent cancer by identifying and removing precancerous growths. Current guidelines recommend starting screening at age 45 for most individuals, but those with a family history or other risk factors may need to start earlier. Advancements in screening technologies have made these procedures more effective and less invasive. For example, stool-based tests can detect signs of cancer early and can be done at home, offering a less invasive option for initial screening. However, colonoscopies remain the gold standard, providing a comprehensive view of the colon and the ability to remove polyps during the procedure. It is crucial to overcome the stigma and discomfort associated with colon cancer screening. Education and open dialogues can demystify these procedures and highlight their importance. The rise of colon cancer in young adults is a public health issue that requires immediate and concerted action. It is imperative that we shift our perceptions and understand that colon cancer is no longer a disease only of the elderly. By increasing awareness, adjusting screening guidelines, and promoting healthy lifestyle choices, we can combat this disturbing trend. Every individual, especially young adults, should be empowered with the knowledge to recognize the risk factors and symptoms of colon cancer. Healthcare systems and policies must evolve to support early screening and preventive measures tailored to younger populations. This includes advocating for lifestyle changes, promoting genetic testing where applicable, and ensuring that all young adults have access to appropriate and timely healthcare. Together, we can make a difference in the lives of many and change the course of this silent epidemic.